Hey guys, what's up? My name is Vince from Adult Therapy Alliance, and today I want to talk about the difference in different kinds of therapies that exist today. Sorry, I'm all over the place. I don't have a script or anything. So modern day therapy focus more on like observable behavior, like evidence based practice, which is excellent. Which is excellent for every single thing in science. We need that to prove things, you know, the scientific method. However, when it comes to psychology, it's a little bit different. In my opinion, it's very different. And we're like losing. It's a little bit different because a lot of the things about being a person, you can't really. Like, you can't quantify. Like, you can't quantify the unconscious. Like, we have to go off of theories. And there was many theories made like 100 years ago, 50 years ago, that are now being lost in modern day therapy. And like, you have to go out of your way to go and learn this stuff now. Like, schools do not teach this anymore. And that's the psychodynamic theories. And even if you don't use like these theories in your practice as a clinician, the way it informs you in terms of treating people, understanding underlying issues with the unconscious, and like why are people behaving this way, it helps you see people more accurately. You can understand human suffering in a more dynamic way. The word like psychoanalysis, if you read these textbooks, like Freud came up with this, and what it really translates to is investigation of the soul. And a lot of people hate Freud, or not hate Freud, they like make fun of him for his like bizarre theories and things. But he created the foundation of psychology. He's the father of psychology, right? This guy's not a whack job. Like, some of his ideas are wacky, sure, but to say that they're worthless, to say that he doesn't know what he is talking about would be for the furthest from the truth. Like, this, he has a lot of concepts that are absolutely pivotal to modern day therapy. Just the idea of transference and countertransference is the basis of modern all therapy. Every single individual session you've ever been with a therapist, the therapist is thinking about the transference and countertransference in that relationship. And I'll have to make another video for that. But it's basically just the quality of the relationship and how they are reacting, how the patient is reacting, according to like the dynamics of like how they grew up as like a kid with their parents. But anyway, I digress. So the two approaches to psychology is there's an inside out approach and there's an outside in approach. So modern psychology does the outside in approach. They see the behaviors, they observe the behaviors, then they treat the behaviors, the cognitive distortions, by teaching skills, teaching mindfulness and whatnot. Whereas the inside out approach is more like interpretation. It's a lot of not quantity, more quantitative work where someone will tell you about their childhood and their relationship between their parents. And then maybe they'll talk about their relationship with their like siblings or with their significant other, and that's where the therapist would come in. And the work is subtle. It's not overt. You're not going to go to these, like if you ever go to a psychodynamic therapist, the work is going to be like very discreet. Like, you might sit in a session, like 5 sessions, and you'll be like, what is going on here? We're not like doing any worksheets. I haven't learned any skills. Like dialectical behavioral therapy, there's all about skills, like learning skills. And to me, when I think about that kind of therapy, it's more to help a person develop skills to understand their feelings, understand other people's feelings, and how to respond to your feelings, their feelings, how just to talk correctly to people so that you're being understood, not to be misunderstood. Like like those kinds of therapies, like dialectical behavioral therapy especially, was made for, I'll even tell you, it's made by Dr. Marsha Lanahan. And she made it for women that struggled with severe bipolar with SI, severe SI, like very severe. Like they're in the clinic with her, and she did these studies for like years and years with these people. And the whole point, when I think of dialectical behavioral therapy, the whole point of this therapy is to reduce cognitive distortions, help people learn how to communicate their feelings, understand their feelings, be mindful of their triggers, and actually express them to people in a meaningful way so they can build relationships. That is the like when I think of these things, like that is what it is exactly for, to build relationships. Because when you build relationships, you can cure a lot of things. Like for instance, like addiction in itself, the disease is a relationship disease. It's a feeling disease. That's why it's so complicated. People don't want to understand. Addiction, for instance, I'm an addictions therapist, and addictions is complicated and it's hard to describe to people because like people think so logically, right? Like it's not like a logic disease. It's a feelings relationship disease. Like it's your relation. It's if I was with a client, I need to understand their relationship between them and their drug of choice or whatever the addictive behavior is. Why is this bond with this relationship so powerful? How did it get this way? What's preventing you from building new relationships? When we meet our needs from actually meaningful relationships, that's why, I know I'm all over the place, but that's why when you think of the 12 steps and the AA groups, I know people hate this stuff. I don't really want to talk about the hate. I just want to share an idea, okay? And the reason why the higher power is important is because that relationship tends to be more meaningful than the relationship with a drug or a ritual that you do to take the drug, or with food or gambling or sex. That's much more meaningful than that stuff. Like you'll get meaning, you'll feel better. Like I'm not saying that you will feel better, but certain people, they go to church and they feel better. They feel better. They feel closer to God. They want to aspire to carry the same values that they have learned in church. That makes them feel fulfilled. That's why people go to church and follow religions. You don't have to do that exactly. There's modern ways to do this now. Okay, I'm not enforcing any. I'm not saying that that's the be all end all. I know the internet just twists words nowadays, but I'm saying like that's why people they need a higher power often. They need relationships. Addictions, you cannot fight addiction without healthy relationships. There's no way. That's why isolation is a terrible thing for like most mental health issues, and especially addiction. Especially addiction. Another problem with modern day therapy is that because it's an outside in approach, like say you come to a clinic and I see you for 6 months. I see you for 6 months. 6 months I see you, right? I see you, you sit in my office. I see you for 6 months, and all of your behaviors and tics and stuff that people find inappropriate, that's like messing up your life, we nail down. I make you a pristine person. Like you have the charisma of James Bond by the time you leave. Like, does that mean that you're cured? Does that mean that you do not have pain in your heart, that you're not suffering inside? Like, what if you are? That's the problem. Like, you can absolutely be in dire straits in your heart, but you are not showing it because I taught you every skill to behave perfectly in society, of how to handle your triggers, of how to express your emotions. But what if you're still in pain in your soul, right? What if you're still conflicted? What if there's something missing still, right? And that's the problem. That's the major issue in therapy today. Because we look at the surface of behaviors and we're like, oh yeah, this person's fine now. Like, he's been to treatment. He's acting like a normal person. He's fine. But, if you're like a therapist who also understands the inside out approach, will understand that just because you're not presenting with symptoms does not mean you're doing good. In fact, you might be even doing worse. because now you're maybe very good at hiding those symptoms. And maybe you don't even understand where the pain is coming from. Like, I've done all of this work, and I'm still not feeling good about myself. How do we help that? Where is that pain coming from? How do we close the circuit? How do we get closure on things? How do we better understand ourselves? That's where we tap into the unconscious. And the problem is, in today's society, due to insurance purposes, insurance is not going to cover that. I've met so many patients that needed more help, but they get kicked out of treatment because they present well. They come to all of the groups. They're getting enough sleep. They're not acting belligerent. But in their heart, they're absolutely destroyed. They're not good at all. And then I see them 2 weeks later after they relapse. And it's a disaster. It's an absolutely fucking disaster. And it's hard to prevent because modern day therapy focuses on short-term treatment, not long-term, very in-depth treatment, short-term treatment. And these insurance companies expect you to follow evidence-based practice, which is not necessarily the best modality for every person. You're going to miss half of the person. The thing is, absence of symptoms does not mean the person is healthy. Absence of symptoms does not mean a person is doing good intrapsychically. Does not at all. Right? That's why you can see people that have all their needs met in terms of like famous people or whatever. Like, they're rich and they're famous. They get validation from everyone. But in their heart, they're absolutely distraught. They're absolutely messed up. Why is that? Why is that occurring? To me, that's so telling. That's telling me that there's something more to it. There's something we haven't gotten to the root of. And that's a very upsetting thing as a person, as a clinician, to see that it's just being invalidated in schools. In fact, schools are going out of their way not to teach psychodynamic theories anymore. And that sucks. That sucks for everyone. It sucks for the therapist because they're not getting trained in things that they should know to help treat people. Like, imagine you're building a house and I don't give you a hammer. Like, good luck building the house. You're not going to be able to put any nails in the wall. You're not going to be able to put up the wall. I mean, I don't have a solution. I don't have a solution. Insurance is going to pay only for things that are evidence-based, right? I would encourage people to read books, learn more about themselves. Seek out help from people if you can afford it that will be willing to do psychodynamic therapy with you. If you are really, in your heart, know there's something is off. But you don't know how to get to it. Finding a therapist that can do that someone who's competent and knows what they're doing will be able to hopefully get down to the bottom of something. And there are therapists all over the world that do practice these things. There's Lacanian therapists. I'm sure there's some like very, very old school like Freudian therapists, and like all of these different kinds of psychologists and things from the past that have developed all of these different theories. A huge issue is like a lot of times the reason why they get discounted is because they think they're bizarre. Their ideas are so wacky, but all of their ideas are wacky. Every single thing, we're going to just throw out the basis of psychology. I don't think so. There's ideas in all of these things with a grain of truth, something that can help a person understand themselves better. The whole point, Freud even talks about it, is he's a psychologist to understand human suffering and to reduce human suffering. Like, that was his goal. It wasn't to become a millionaire. It wasn't to surprise everyone about how smart he is. Literally, he wanted to help people. And today we can still use these things in the modern day to help our clients, to help my patients, to help my clients. But anyway, that's my thoughts on psychodynamic theory. I will have to make a whole video on like what psychodynamic. There's so many different structures. It's kind of like a lens on your camera. Like, how do you want to view this image? You know, do you want a 50 millimeter lens? Do you want a 100 millimeter lens? Do you want a macro lens, a micro lens? You know, do you want a vintage lens? It's perspective. It's to help people gain perspective, and it's very subtle. It's not evidence based. You're not learning skills. You're just it's not exactly talk therapy either, where you're just wasting time. It's very the person that you're talking to across from you is going to help lead you in a direction to help you understand why things are happening the way they are, the symbolic nature of our behaviors and how we react to things. And once you understand those things, like, there's no going back. Like, once you understand it, like, yourself, like, why you're doing a certain thing in a certain way, like, when you emotionally attach to it, when you emotionally understand, that's like the problem in therapy. It's like, what we're not trying to do is logic our way through things. We're trying to emotionally understand something on a very deeper level. There's no words for it sometimes. It's like, you'll have to feel it to understand. And once you feel it, once you have that attachment to that feeling, to the symbolism of why these things are happening in the psychodynamic structure, like the theory you're using, like, I don't have to tell you. We just need to get to it, right? Like, exactly. And I don't know if like telling you is going to help. Maybe that will actually go against the therapy itself. It just depends from what perspective you're trying to work from. And there is no one theory that is perfect. There's no one theory that explains humanity perfectly. Like Freud said, like, sometimes a cigar is just a cigar. And that's true. Sometimes it's just, trauma is just trauma. Sometimes anxiety is sometimes it's just anxiety. I don't know. But people are very complicated. Like, there's nothing that will explain something 100%, but we can try to understand the best we can. And if it just helps a person just sleep at night, if it helps you develop a better relationship with your kids, if it helps you understand why you avoid certain things and why you're attracted to certain things, like, that's a good thing for your existence. So anyway, that's my rant on psychodynamic theories. Thank you guys so much for watching, and I will see you guys in the next one. Thank you.